I will give a lecture about the cold water injection, the clinical value of cold water injection for the management of nerve damage symptoms during thyroid RF ablation. Here is the first case, RF ablation of recurrent cancer in light OP bed. You can see the recurrent cancer abutting to esophagus and trachea. As we know, here is the usual location of a laryngeal nerve. So before ablation, I tried separation of the tumor and esophagus by injecting water. We call the hydrodissection technique. And then I started ablation. Here we can see the RF electrode, and here hydrodissection needle together. During ablation, we injected a small amount of water continuously. However, the patient complained of voice change, maybe heat transmission to the laryngeal nerve. So I stopped the ablation immediately and then inject cold water around the tracheoesophageal groove here. You can see the injected large amount of cold water. During injection of cold water, the patient recovered his voice completely. The second case is a benign thyroid nodule here, a big nodule here, compressed esophagus and trachea. Here, it's maybe tracheoesophageal groove, the location of laryngeal nerve. I started ablation. During the ablation, the patient also complained of voice change. So stop ablation and then inject large amount of cold water at the tracheoesophageal groove. This patient also recovered immediately. Voice was completely normalized. We experienced these cases and published this retrospective study. In this study, we experienced various kinds of nerve damages, laryngeal nerve, sympathetic nerve, and vagus nerve. But we inject cold water in 11 patients and not injected 5 patients. What about the recovery time? Recovery time of voice or other nerve symptoms are very fast in injected group compared with the non-injected group. So I would say, point 1, cold water is really effective for damaged nerves. After this retrospective study, we changed our daily practice. During RF ablation, if there is nerve symptoms, especially voice change, we immediately stop our ablation and inject cold water. So this is a prospective validation study. In this study, the cold water injection improved, recovered the nerve damage symptoms. You can see the immediate recovery in majority of the patient. That means the recovery of voice change during injection of cold water, immediate recovery. But we have 4 patients with a late recovery. The causes of late recovery was a delayed detection of nerve damage. So we recommend frequent checking of patient voice problem. This is our protocol. Now, during our RF ablation, if there is nerve damage symptoms, we immediately inject cold water, and at the end of a procedure, we inject 1 ampoule of dexamethasone around the nerve, damaged nerve. So last question is amount of cold water. I would say, please inject cold water until complete recovery of nerve symptoms. Thank you so much. So is there any questions? A lot of questions from the floor. First question is pure water or cold saline injection. As I introduced, we inject 5% of dextrose water, cold water around 0 degree. And thank you so much. A lot of questions. Cold water means the 5% dextrose water. And in patient who did not receive cold water injection, was there permanent damage in any cases? Very, very rare. Permanent damage is very rare, but we have permanent damage during treatment of operation bed recurrent tumor because it is very close to recurrent laryngeal nerve. And one question is why 5% dextrose water instead of saline? My answer is saline. It consists of a plus and minus ion, Na plus and Cl minus, that can induce thermal damage to surrounding structures if we go on RF ablation after cold water injection. Do you have any patient talking during the procedure? Yes, we always talk about 1 or 2 minutes. We continuously talk with the patient to check their voice. So many questions. How do you monitor voice change during procedure? We talk each other with the patient continuously and frequently. How often to check voice is about 1 minute. And if I treat the area near the laryngeal lobe, I always check the voice. Cold water temperature, the question is cold water temperature. It is around 0 degree. How do you add the dextrose to the water? No. We use the 5% of dextrose water. And why not inject cold water? Yes, that's a good idea. But as we know, isotonic in water, we use the isotonic water. That is 5% of dextrose water. And it has no ions. That means no damage to surrounding structures when we doing thyroid RF ablation. I frequently check how much do you inject. That's a very important point. We inject as much as possible. After recovery of voice, we inject more because injected water disappeared rapidly along the neck anatomic plan. So we inject more, usually 10 or 20 milliliter of water more after recovery of voice.